Katelyn Rivadu. I'm going to be doing my head-to-toe assessment skills video today. First, I'm going to start by knocking on the patient's door, walking into the room, introducing myself, providing privacy. I'm going to perform hand hygiene and don my gloves. Sir, my name's Katelyn. I'm going to be your nurse today. I'm going to be performing your physical assessment. Is that okay with you?
Yep.
Awesome. Can you confirm your name and date of birth for me?
Yeah, it's Sean Rubidoux. It's 1-2-32.
Okay, awesome. And then I'm just going to start by observing the patient's overall presence, so you can tell that he is groomed, doesn't appear to be in any distress. He appears to be comfortable and not in any visible pain. I'm going to start by taking the patient's vital signs. We'll do blood pressure, heart rate, respiratory rate, temperature, and also the blood pressure. I think I already said that. And then I'm just going to ask the patient if he's in any pain. Sarah, are you in any pain today?
No.
Okay, great. And then I'm just going to start by doing my physical assessment now. Is that okay with you, sir?
Yep.
Okay, so I'm just going to start from the head. I'm just going to work my way down. Is it okay if I feel around in your hair?
Yep, no problem.
Okay, awesome. So I'm just going to feel around in the patient's head and see if there's any redness, dry skin, anything like that. The scalp doesn't appear to have any lumps or bumps. Any pain while I'm feeling around?
Nope.
Okay, great. And then while I'm here, I'm going to check the patient's hair as well. You can tell that there's no balding, no thinning of the hair, no patchiness within his hair at all. And then I'm just going to work my way down to go, so I'm just going to look at the facial symmetry. You can tell his face is symmetrical. There doesn't appear to be any deviations on any side. I'm just going to begin to look at the patient's eyes next. So you're going to just, I'm going to make sure that the pupils look symmetrical on both sides. The eyes are evenly dispersed on the face. There doesn't appear to be any deviations there. I'm just going to start by checking your eyes with my light. Is that okay, sir?
Yep.
Okay. Keep looking at my finger. Okay. The pupils are equal, round, reactive to light and accommodation. So next I'm just going to have you look at my finger and follow my pen light. Okay, great. And then I'm just going to start by keep looking at to make sure the sclera is white. There's no yellowing or redness to the sclera, which is great. And then I'm just going to go to the patient's nose next, so you can tell it's symmetrical and in line with the face. I'm just going to inspect the outside, make sure there's no drainage or anything like that, which there is not. I'm just going to look inside the nares now with my pen light. Is that okay with you, sir?
Yep.
Okay. We're going to look on both sides to make sure that there's no redness. There is also no lesions, no abrasions, no drainage, no bleeding. And then, sir, I'm going to have you check, put your finger on, cover one nose, and then breathe in and out. Perfect. And then the other side. Great. So the nares are patent on both sides bilateral. Doesn't appear to have any deviations on either one. Next, I'm going to move to the patient's ears. I'm going to check the outside appearance to make sure that there's no drainage present, no redness. Doesn't appear to have any lesions or abrasions from the outside. And then I'm just going to take my light and look inside the ear. Okay, we're looking at the tympanic membrane. It's gray, it's pearly. Doesn't appear to have any swelling or redness, no irritation, no drainage. Same thing on the other side. Okay, both sides are the same, so there's no drainage, no redness, no swelling, anything like that, no bleeding. And then I'm just going to move down to the patient's mouth, and I'm just going to inspect the outside of the mouth. We're going to look and make sure that his lips are pink and moist, which they are. And then I'm just going to have the patient open their mouth. Sir, can you open your mouth for me?
Yep.
Great. I'm going to inspect the inside. You can tell that the buccal mucosa is pink and moist, and it is, there's no lesions, no abrasions. The teeth are all intact. There's no concerns in regards to the patient's teeth. And then, sir, can you stick your tongue out for me and say, ah?
Ah.
Okay, great. The tongue is also pink and moist. There's no redness, no abrasions, no lesions. Also checking the uvula, it's midline. No redness, no irritation. The tonsils are symmetrical on both sides, don't appear to be reddened or enlarged or swollen. And there's no lesions anywhere in the mouth. And the next thing, I'm going to just move down to the patient's neck. So I'm going to check the patient's lymph nodes and the carotid arteries while I'm there. And I'm just going to feel around. Is that okay, sir?
Yep.
Okay, great. So there doesn't appear to be any swelling. Is there any pain while I'm feeling around?
No.
Okay, great. And then I'm just going to check the pulses on each side, which they are equal, regular, rate and rhythm, which they are. And then I'm just going to I'm going to check the neck range of motion. So sir, can you just tilt your head left and right and kind of around in a circle? He appears to have full range of motion in his neck. And then just a shoulder shrug for me. Okay, great. So great strength on all the way around. The range of motion is great and within range. And then next thing, I'm just going to check the patient's lungs. Sir, can you sit up for me? Okay, I'm just going to listen to the front first. Okay, and I'm going to also listen in the back. Okay, lung sounds are clear in all quadrants, in the front and the back. There's no wheezing, no crackles, no rhonchi, anything like that. The patient does not appear to be in any respiratory distress. He's breathing even and unlabored. The chest rise and fall is also symmetrical and even and unlabored for his breathing. I'm just going to move down to his heart now and check. I'm going to listen to his pulse. Okay, great. And then I'm just going to check the capillary refill on both hands. So can I just check your fingers? Thank you. Capillary refill is less than 3 seconds. Also going to check the radial pulses while we're here. They're equal bilaterally, regular, rate and rhythm. And then I'm going to check his pedal pulses as well to make sure those are regular, rate and rhythm, which they are. And I'm going to also check the capillary refill on his feet, which is less than 3 seconds bilateral. And then next, I'm just going to move down to the GI system. So sir, can you lay down for me? Thank you. And then I'm just going to inspect the abdomen first. Is it okay if I lift up your shirt? Yep. Okay, great. And then, so the abdomen doesn't appear to be distended, no bulging, anything like that. I'm going to take a listen to all the bowel sounds now. Okay, bowel sounds are active in all 4 quadrants. I'm just going to palpate the abdomen now. Is there any pain while I'm feeling around?
No.
Okay, great. Doesn't appear to have any swelling, discomfort while I'm palpating. Sir, can you tell me your last bowel movement?
This morning.
Okay, was it regular for you?
Yep.
And do you ever have any issues going to the restroom?
Nope. Okay,
awesome. And then I'm just going to move down and start inspecting the patient's skin. So I'm going to start with the legs. Is it okay if I lift your shorts up a little bit?
Yep.
Okay, great. I'm checking the skin color. There's no redness, no bruising, no abrasions, no cuts. Both sides appear to not have any edema, no swelling. Okay, and I'm going to check your arms as well. Same thing, looking for any bruising, redness. The skin does not appear to have any of those things. Okay, great. And then can you sit forward for me so I can look at your back? Okay, awesome. And then I'm just going to have the patient stand up so we can check his gait. So, sir, can you stand up for me? Okay, and then can you just lean forward and touch your toes? Great. Any pain while you're doing that?
No.
Okay, awesome. And then I'm just going to have you walk forward and back for me. Okay, awesome. Go ahead and have a seat. And then I'm just going to ask the patient some orientation questions. So, sir, can you tell me what day it is today?
Thursday.
Okay, awesome. And the year?
2024.
And do you know where you are?
Yeah, at the hospital.
Okay, great. So patient is alert and oriented ×4. Does not appear to have any confusion or disorientation. Mental status seems to be within range. And then I'm just going to, we already checked hair, skin, and nails to make sure that those are all moist, no abrasions, no lesions, no bruising, and okay, so that's going to complete your assessment today. That's it.